All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren, your host, and I'm a prenatal and pediatric chiropractor here in San Diego. And on today's episode, I'm doing something totally different, something I've never done before on the podcast. I'm going to be interviewed by my colleague, Care Messer. I've done dozens of interviews on other podcasts. Obviously, I've interviewed over 100 people on this podcast. I've done monologue episodes on this podcast where I've presented material that I wanted to add to the library for your use. But this is the very first time that I'm turning things over to somebody else and them asking me questions. So Care Messer, she's been on the podcast a number of times. She's one of the founders of the CAP Wellness Center, the Prenatal Wellness Center that I'm a part of in San Diego. She was my hypnobirthing instructor for my son's birth. She was our doula, so she was present at my son's home birth. And she's a great friend, a great colleague. And now she's going to ask me some questions and see if I can answer them. We're going to be talking about prenatal care. We're going to be talking about postpartum care. We're going to be talking about infant care, all really kind of within the context of chiropractic care and the work that I do clinically day by day in my office. So I'm just going to turn it over to her, and she's going to ask the questions, and hopefully I can come up with some good answers. Here we go.
Okay, I'm hijacking Jay's podcast today. I'm sure you were expecting to hear his voice pop on here, but my name is Care and I own the Birth Education Center here in San Diego. And I wanted Jay on the other side of the microphone and screen today so that we could interview him and pull his expertise, since he's always pulling it from everybody else. And I refer to Jay constantly in my classes and to everybody that I talk to online as well. So I want to kind of pull from him today and spoil him a little bit. Is that okay, Jay?
That's great. I've never had my podcast hijacked before, and I would only want it ever done by you. So I'm happy to be here with you.
That's good. I'm going to try and keep my cursing and my foul language to myself so that
Excellent.
all your
Family
listeners
program.
stay.
It's a family program.
Program. Keep everybody tuned into you. I want to give you a little background of who Dr. Jay Warren is. Dr. Jay has been doing pediatric and prenatal chiropractic for over 20 years. I've known Jay for 10 of my 11 years in birth work. He works at CAP Wellness Center in Encinitas, California, and has 90% of his practice being babies and families. He also serves as an instructor for the ICPA, the International Chiropractic Pediatric Association, teaching a course called Pregnancy, Birth, and Infancy from the baby's perspective, which you're so qualified for that class. That's so brilliant. Dr. Jay hosts two popular podcasts. Of course, this one, Healthy Births, Happy Babies, for the pregnancy and postpartum journey, and also the dad's journey for dads and what they can expect in parenthood. And I like that one a lot because it's real life stuff that Jay pulls out from his real life stuff with his kid, which is hilarious. And also really tender at times. So I love the vulnerability of that podcast. Jay also has two online programs that he's created. One is called Connecting with Baby, and specializes in the prenatal connection between mom and baby, which really helps you feel confident and comfortable as baby comes in because you already know the baby, your baby. So I love that one as well. And then the new dad's class, which I sell constantly to my families because dads get mixed and left out of the mix a lot. And that new dad's class is fantastic, Jay. You've done a great job with that.
Thank you.
So I have a little bias when it comes to Dr. Jay because not only did he come to my hypnobirthing classes when they were pregnant, but I also got to attend their birth as a doula. And I got to wear a hot pink feather boa at their request, which made me feel very comfortable and confident. And my favorite picture from your birth was Effie sent me her favorite picture, which was the hallway. And I was like, what? That's such a weird picture. And there was one pink feather in the hallway. And she goes, I'll never forget this. And I was like, oh, that makes me feel so good. That's just something that I've never shared with anybody else at a birth. So I love that. Jay is a leader in our chiropractic community, and I'm excited to get to turn the tables on him today. So thanks, Jay, for letting me do that.
Sure. I sound as busy as I feel with
Yeah.
all of that.
You are.
There's a lot going on.
Today, we're going to cover some important topics for the families that I serve, the families that you serve. And we're going to start with the different delivery types: cesarean, forceps, and vacuum assisted delivery, because those aren't usually covered in birth classes. And the reasons for adjusting baby afterward. I also believe that babies should be adjusted just for any kind of labor, because we don't know if their head was cocked one way and they were hitting a pelvic bone, or just turned funny until they got tucked, and all of those things can affect them on the outside. We're going to cover breastfeeding issues and preventing breastfeeding issues, tongue tie issues, and how chiropractic works, and colic issues, because all of those things can show up in babies that aren't adjusted 5-6 weeks out. And just by doing something preventative as they come out of the womb and the birth canal, we can prevent a lot of those. And we see that all the time. So that's why we talk about it so much in our classes and recommend chiropractic, no matter where you are, finding the right chiropractor for you. And does that sound good so far, Jay, for our...
Yeah, this is going to be great. There's so much information I'd love to share. One, with your audience, two, with the ones that are listening now. So let's do it.
I know, I'm excited. So first, I want to talk about the safety of chiropractic, because the first thing that comes to mind when I bring it up in classes is, oh my gosh, rack 'em, crack 'em. Like, I can't even imagine a chiropractor doing an adjustment like they do to my neck on my baby. And that's not what happens. So can we talk about the safety first?
Yeah, absolutely. I mean, there are so many different chiropractic techniques out there, and predominantly most people think of what you just said, or the cracking and popping. It's more structurally adjusting. Is the joint misaligned? Is it stuck? Put a large force into the body to get it moving again. And that technique and those techniques can be very safe as well. I mean, we have a great safety record. Our research shows that. But then dropping down into pregnancy and birth, and then into babies, those chiropractors that specialize in those areas specialize in other gentler, lighter force techniques like the ones that I use. So even if a chiropractor has been working with a woman all the way throughout, like before they even got pregnant, most of the time they'll switch gears and using a different technique. So it's gentler on mom's babies or bodies, gentler for pregnancy. And then especially with working with an infant, we use these light touch forces to help move the vertebra and calm and balance the nervous system. So it isn't going to be rack 'em, crack 'em. It's not going to be any experience like that. But it makes sense that if people have had that experience as a patient, as an adult, and that was the technique they had, there's no way you'd let your baby do that. And so I always try and tell my patients before they even come in, and definitely as soon as they come in, like, I'm not going to be doing any of that kind of work. It's going to be very gentle. It's going to look like I'm holding your baby most of the time. Maybe it doesn't even look like I'm doing anything because it's so gentle.
It looks like you're not doing anything.
Right.
Like, it really does. You're like, and I'm charging you for this session.
Exactly. But then they leave and like, oh my gosh, my baby slept. Oh my gosh, my baby finally pooped. Oh my gosh, my baby's like not as fussy. So like something happened. That's what they say the next time. It's like, I got to be honest, Dr. J, I didn't really think you did anything, and wondering why I brought my kid here. And then we had a great night last night. So like, do it again, whatever you just did.
And I, being at your birth, I watched the whole process, was a part of it. And you adjusted Nico 17 minutes out. So he was still warm. Placenta was still warm, like 17 minutes out. And it was such a gentle adjustment. And I got to take pictures of it and witness it firsthand at a birth, which a lot of birth workers are not going to see that unless they're with a chiropractor at the time. Yeah. But it was so gentle and smooth. And you just checked for whatever you checked for. Right. And yeah, I can, just from personal experience, I can attest to how gentle it is.
Right. I mean, when a baby comes out, like as a new parent, you will soon know, if you don't already know, they're bobbleheads, right? You got to be really careful with their head because they don't have a lot of muscle tone. So there's no reason you don't need to put any kind of high force into their bodies because there isn't a lot torquing it out of alignment. It's usually a tension pattern in the nerve system, the stress of coming through the birth canal, or what we're probably going to be talking about soon is the stress of trying to be going through the birth canal, but then it not proceeding naturally and effort and simply, so that interventions are necessary. So one, the interventions can cause misalignments in the spine so that their nervous system is stressed and there's subluxation interference in the body being able to heal from that. So that's why a chiropractor would come in and help release that stress from the nervous system so their bodies can heal and balance and regulate and go back to being a balanced, calm baby rather than one that's been traumatized or injured from the birth.
Well, and I would like you to show on, well, we don't have a baby because we don't have a baby to show,
No.
but show us kind of where the adjusting parts are on the baby and how gentle it is.
Sure. So as you just said, I do not have a doll here to do it. So I don't have that demo, but I do have
A
this little
dinosaur.
stuffed animal. Like Pete is his name, kind of Pete's dragon. Pete was the boy, but we called him Pete all the way along. It's my son's stuffed animal. So with an adjustment, most of the time when I'm first starting, like I'm going to be holding the baby just as you would, like cradling them so that they feel comfortable with me. I'm talking with them, kind of explaining to them as the conscious being that they are of what's going to be happening rather than just talking to the parents about what I'm going to do to their baby. I'm explaining things obviously, but I want to make sure the baby's included in that conversation because I'm going to be working with them directly. But when I'm holding them, there can be it's in a cradle position, but if I have them up on my shoulder, like they're kind of going over there, this is so funny. These are almost like little vertebrae that I can.
I know, I love it.
With.
It's great.
It's perfect. So if I'm holding them up like this, like with my hands, this is, if you look, like right at the base of the neck where the skull starts on the spine is usually where most of the stress tension will be created in the birth process. And sometimes even in utero in the pregnancy, there'll be a compression or a misalignment. And the reason why that's so important is because the brainstem passes through that area. The brainstem neurologically has breathing centers and cardiac centers. It has digestive centers and it has immune centers. So neurologically, if there's stress tension at the top of the neck there, the whole nervous system is going to be more stressed. It goes a little more into fight or flight than rest and digest. So those babies are seemingly agitated all the time. They're fussy. They're constantly needing to be rocked and cuddled. And babies love being held, don't get me wrong. But if they're always fussy and needing something to calm them down, it's usually something's in their nervous system. That I'm doing this with my hands because they're kind of jittery. They're kind of antsy and just can't calm. And they need mom, they need dad, their breath, their warmth, their soothing, bouncing, those kind of things in order to calm down enough to be able to feed, to be able to sleep. So when I'm doing the adjustment, I'm looking primarily at the top of the neck. There are times where I'm looking down in the pelvis. If there's usually a baby coming head down through the birth canal, their pelvis is kind of along for the ride. It's the head and the shoulders that forge the way. So there isn't much misalignment in the pelvis, but I always check that. But in the base of the neck here, I'm feeling to see, is it tight? Is it misaligned? And really the amount of pressures that I put to do an adjustment is the amount of pressure you'd put on a closed eyelid, or if you wear contact lenses, the amount that you put in there. How could such a gentle pressure make a difference in having their baby sleep or poop or be able to latch better? It's because it's not just an amount of pressure, it's where to put that pressure that a chiropractor is trained in and how much, as well as the direction. And the direction is really key. Like anatomically, we know like where balance should be. So we know if it's misaligned, which direction to be able to push on. So as I'm holding baby up like this, I'm just feeling into their neck there. And then usually it's my index or middle finger. Sometimes it can even be a pinky pressure. I'm just applying pressure to that vertebra here that might have misaligned off to the side to be able to come back into balance, and I hold it. So if you've had a previous adjustment, a chiropractic adjustment, it's usually quick and fast. With infants, typically what we do is more of a sustained contact where we're kind of, if the vertebra is off to the side, we're putting pressure for it to come back into alignment. And then I hold it there. So their brain has a better picture of where balance is, where alignment is. And because there isn't a lot of tension that's going to pull it back out because they're a brand new baby, it hasn't been there for days, weeks, months, even years or decades like us adults, then we can hold it there. And that interference, we call it subluxation in chiropractic, that's preventing the brain from doing that itself, can then be eliminated, and then the body can come into balance. So really, like when they're up on my shoulders, I'm holding, and I might be talking with baby, I'm holding this pressure with my finger. And then once I feel that that calm has come to the system, I let it go. And then I let the baby kind of move around with it. And then I feel again to see if it's been held. If it's being held, the adjustment is complete. And then it's almost like the adjustment starts working at that point. Like it's now the brain has a better picture of where it's been out of balance and where it needs to heal. The channels open in the nervous system to be able to do that healing, because our bodies are designed to heal. I mean, you cut your finger, the body heals that. It should do the same thing with the misalignment. It's just that nerve stress in the way. And that's what we as chiropractors do, is eliminate that so the body can balance itself. The body can heal itself. I'm not doing any healing on my own. I'm just getting the blockages out of the way so the body can do it itself. Does that make sense?
Yeah. And it's such a specialty, because I have watched you do that, and it's just, the direction, the pressure to put, but it does look like you're doing nothing.
Sure.
But
sure.
That pattern isn't like when you're adjusting me and it's been sitting here for 30 years, because I was like, I don't need a chiropractor, I'm fine. And then when I go, you're like, holding it like that, which you're really not, because you use the activator technique, which is much softer. But it's not a pattern that's just that the body has locked into to protect the baby from pain or discomfort for a long time.
Right.
And that's so important to get it done ahead of time, early.
Yeah. And it is a specialty. I mean, depending on what school the chiropractor went to, they may or may not have even had pediatric classes. I went to a school that taught pediatrics, but even afterwards, I did extra training with the ICPA, the board that, or the organization that I'm now teaching with, to have advanced training to work with babies, because a baby's spine isn't just a smaller version of an adult spine, right? It's not like we can just go in and it works the same. The curves are different because they're brand new. They're just much more gentle. The vertebrae move in different ways until the spine develops in these first couple of years. So it really is a specialty. So you want to find a chiropractor that's trained in it, has had advanced training, and it's usually either through other parents that have taken their kids to a chiropractor that would give you a recommendation or a referral, or it's through our organization, the ICPA, that has a listing of all of us chiropractors throughout the world, like the US, like abroad, anywhere that you are, to be able to find one close by you that does these kind of specialties and works with infants all the time. So while you might not have met them before or had a direct referral from a friend that can say, oh yes, like this doc is great, like you can trust that this person works with babies all the time and is trained to do so, and it is very, very safe for them. Because it's truly an honor for a parent to bring their baby to me and to hand their baby over to me. I'm a parent. I know what it's like to a relative stranger, which I might be to them because I meet these parents right away, to hand your child over to someone like Papa Bear and me and Mama Bear and mom, like comes up, and you're very protective. So you want to be really safe and secure with the person that you're working with before you even start anything. And the training and looking at their website and listening to like how they work with infants is really important to start off.
Well, and unless I knew you were confident in holding a newborn baby, because as a new mom, I'm not confident holding a newborn baby. I don't want to hand it to you where you're like, I don't know, I want to be able to hand it to you and you're like, I got this, let me show you.
Totally.
That's for a new family, that's really important. And it comes from training. And I tell my families, look at the websites, because you're going to know if there's boobs and babies all over the place, that's what they do. If there's sports injury stuff, that's what they do.
Exactly.
So you're going to know that.
And I'm thankful to get a lot of referrals from other chiropractors that know that they don't know the pregnant spine and or a baby's spine, and I'll work with them for the pregnancy and postpartum and with the babies, and then refer them back to their other chiropractor. And so they recognize that, yeah, this is a specialty that I don't I'm not familiar with. So let me send it over to an expert. And then that mutual kind of caring for patients, like in the chiropractic community, I think is fantastic.
Yeah, it's really non-competitive. I've seen that several times where like my chiropractor said I need to find someone that, does specializes in my pregnant body and, and baby. And then they return back to their chiropractor because it's that mutual exchange. And I like that in the doula world too, when we can say, I'm not going to be your doula. We're not a good fit, but so-and-so would be good.
Exactly.
Because it's all about the baby.
Right.
How do we?
Yeah, it's all about serving the baby and the families rather than about us and our practices. At least that's been my experience in the circles I travel in. And it's just a wonderful community to be a part of.
Mine too. That's why we're friends.
Yeah.
Okay, so can we talk about the different types of delivery? Because more and more common now are assisted deliveries with forceps and vacuum being different from cesarean deliveries because one's being pulled out and one's being pulled out this way. Right. So can you tell us about that and where you're adjusting and what you're looking for in those kinds of deliveries?
Sure. So I do see a lot more misalignment, tension, birth trauma is the phrase we use for it in those births that are needing or have been used interventions. Now, I will say that most of the time those interventions are used because something is going off in the natural birth process and a decision was made clinically in the OBs, and I'm not there, so I don't know like if it was rushed or warranted or not, but something was going on that wasn't allowing that baby to come down the birth canal and an assist was happening. And so there, just as you said, like cesarean injuries and tension patterns, I find are different than forceps and vacuum because as the baby's coming, the baby's head and shoulders and body and their cranium is designed to be pushed through the birth canal. They're not designed to be pulled through. So that's why the tractioning that can happen with forceps deliveries or vacuuming can put a lot of tension on the neck because the head is supposed to forge the way and the cranial bones are just so intelligently designed to be flexible and they overlap, they come through and then they pop open on the other side into balance. But if their baby's being pulled through, that puts a lot of tension on the cervical spine and the neck there that it's not designed to withstand. And so that's in that kind of birth, I really want those babies checked as soon as possible to make sure that any kind of injury is put in position for it to heal properly so you don't see problems later on down the line. Versus with the cesarean, I mean, first saying it's either an emergency C-section or mom's been going through labor for a while and the call is made to do a C-section, different than a planned C-section. That baby's going down into the birth canal, getting stuck, is twisted, can't make it. And so the call is to then pull baby back out through the belly. And what will happen in those cases, I'm seeing two things. One, there's a lot of the compression going through wasn't happening as it should. So there can be misalignments in the cranium, there can be misalignments there. But then with the head engaged in the pelvis and the obstetrician pulling baby's head out, there can be a suction effect in that the baby's head is lodged in there, and to pull out, there's some tractioning happening because the baby's head is a little bit stuck inside there because of the fluids and because of the pressures. So that's another time people will say like, well, my baby was born by cesarean, so like there wasn't any kind of injury to the spine. Why would I need it to be checked? Well, then we go back into like, well, what was labor like until the C-section? And then they think, oh yeah, like yeah, it took 20 hours to get to the C-section, right? Just because they didn't make it all the way through doesn't mean injury didn't happen, and want to make sure that's checked. But then the other thing I'll see a lot in cesarean baby or born by cesarean babies is a lot more acid reflux, a lot more what we describe as colicky, fussiness because of gassy problems. Because with that extraction, babies' spines are typically, if I'm turning to the side, like curled in a C curve, right? But when they're pulled out, they're pulled into extension to some extent. And in the middle of their spine, there are nerve roots that directly go to the stomach and to the diaphragm. And if with that extension that it's not, again, not designed to withstand, those misalignments and irritations can then cause the diaphragm a lot more hiccuping. It can be tight around the opening that the esophagus is going to the stomach, so they're not burping well, or the opposite's true, that valve's so closed or it's so loose that it's letting things up in a reflux situation. So that's another really common subluxation pattern that I see more so in cesarean birth babies than in vaginal birth, or having the vaginal birth with an intervention of the forceps or vacuum.
Well, and they have such delicate systems. You
Mm-hmm.
wouldn't really think, like, how can that kind of birth tighten the little hole that goes from here to here in the stomach?
Right.
And I mean, my daughter had severe reflux, like 6-foot projectile vomit for
Yeah.
9 months before somebody suggested chiropractic.
Wow.
And I was like, do you guys even know what this carpet looks like? Like, why didn't somebody tell me ahead of time? And that's why I preach it, because it was hard. And I mean, I remember coming in once and my husband was covered. It looked like Santa Claus because the throw up was from head to toe. And I was like, I don't know what to do, but no one suggested it.
Right.
And it's so simple. And any kind of birth, any kind of labor, we don't know how baby's head was coming through. And especially if it was a long one. So it's just so good for preventative.
And that's why, I mean, you said I adjusted my son minutes after he came into the world. I mean, he chose me as a dad, so he knew he was going to get checked as soon as he came through the birth canal. But there wasn't a ton of misalignment in his system. But even if there's just like 1% off, like, don't you want your baby like functioning at 100% right from the get-go? And so those little corrections that can be done, like everything seems to be fine, the birth seemed to be fine, all those things. Good. Now let's check the baby, make sure their spine and their nervous system is functioning at 100%. And then they can grow and thrive and develop as they're supposed to, rather than your experience, unfortunately, was it took a while for you to hear that was even an option. It doesn't mean that it works for every single baby. There's no way I can guarantee that. But I know that some help can be given through that adjustment. And sometimes even so, it might be, okay, this is the next step to get the help that you need so that baby's calming down, they're sleeping better, you're sleeping better, they're digesting their food, they're latching fine, breastfeeding is successful. All of those things like could be as simple as something really subtle, because as delicate as their systems are, that can be affected negatively with those kind of birth traumas. With these gentle, teeny adjustments, that tension can be released and they can heal really quick. That's something I'm just astounded by every single time, like how quickly babies can change. Like within 24 hours, they can be new kids. When they come back in for their follow-up adjustments, parents are like, oh my gosh, like our household's totally different in these last couple of days. And I want that for all parents, because being a parent is hard as it is. And then when you've got a kid that is not sleeping well or digesting, like that stress is just so overwhelming. So I want that for all parents, just to be as calm and healthy as possible throughout this huge life change.
Well, and I know some parents are leaving the hospital and they hit your office before they get home.
Yeah.
They're like, we're coming. We just got discharged. How can we get in? Because why not? Like start from the beginning, because it really can save weeks and months sometimes of stuff that could have totally been prevented with. And correct me if I'm wrong, but I find if they get that initial adjustment and put it into place early instead of 5 weeks out, then we don't have to go back 3 times a week to keep putting it back in place, so that the body and the brain go, oh yeah, we want to stay there.
Right. Yeah. Because that tension pattern, if we can correct it minutes, hours, days into their lives, then we reset them so that balance is normal, instead of their bodies adapting to the misalignment being normal and then having to spend more time correcting that pattern that's been established in their body. So yeah, that's the absolute like love of this work of checking a baby just for the sake of checking them and making sure they're starting off life healthy.
Ooh, and they smell so good when they're that new. Well, and let's go into breastfeeding issues then, because that's the next thing that I see as a birth worker, and even doing postpartum work, is babies latching great on one side, and then it has to be a totally different hold for the other side, or they just won't take that nipple, and the mom's producing now just from one side, because baby's like, no, I don't like the right side. No.
Yeah, that's a really common description of breastfeeding that babies are and moms are referred in to me, because that it goes back to that same misalignment at the top of the neck. Like, one, we're talking about nerve system irritation. Their whole system is a little more wound up, so they're not getting into a rested state to be able to do feeding and digesting and eliminating that whole process. But at the same time, that same misalignment pitches their head one direction or another. So just as you described, having a baby in cradle on one side working really well because their head is kind of turned into that side already, but then you switch to the other side, and it's almost like if you've had a crick in your neck where you can turn just fine to one side, and then you have to kind of turn your head in a Frankenstein sense because you can't rotate. The baby can feel that same way, or can function that same way. So not only can they not move to that breast, and maybe mom has to do football hold in order to neutralize the spine that way, but that same nerve irritation interferes with the opening of the jaw. It interferes with sensation on the lips as well as the cheeks, so they can't find the nipple as well, and it interferes with the suck, swallow, breathe mechanism. That's what baby needs to do to one, latch, and two, feed properly. So those sloppy latches, or they fatigue out at the breast, and like you have to keep waking them up to like make sure they get a full feed, are all parts of what we can work with in the top of the neck to see, is that mechanism interfered with, and possibly the problem that's happening with the breastfeeding, so that both breasts are able to be fed upon. And that's a really common description of moms. Is like, well, they feed on the right side because I've more supply on that side, and they don't want to feed on the other side because there's not as much supply on that side. And that may be true because of demand. If baby can turn fine into the right breast, that breast is going to produce more milk than the other side because baby's fussy and finicky. And like, so moms just kind of go to that side. So it might be a function thing rather than just one breast creating more supply than another. That's really unusual in my experience. It's more so the demand of the baby onto it.
Well, and then we add a tongue tie issue to it.
Right.
And so if there is a tongue, a lip, any or both, a posterior or front, whatever, when are we supposed to get that baby adjusted? Before the tongue tie clipping, if we're going to do a revision, during, after, like when do we do that?
Yeah, all of that. So the highest recommendation I have is, again, in a preventative sense, is to have your baby assessed for tongue tie. It's very, very common. There's times where it's slight enough that a mom can get through it, but then it's more difficult than it really needs to be. And I mean, we can't go into a full discussion of tongue tie, but there's so many reasons beyond breastfeeding that the tongue and lip tie, posterior, anterior, all those kind of things being released affects cranial development, palate development, breathing, articulation, all those things down the line. But in a breastfeeding sense, if that is present and needs to be revised, I, as a chiropractor, want to see the baby before that procedure, because that procedure is a surgery. There's going to be stress involved in it. So I want the baby's nervous system as calm as possible to withstand that stress. And I want their immune system as strong as possible by clearing out the areas that we clear. Their immune system is enhanced and will be able to heal properly better from that procedure, having that revision done. And then I want to see them afterwards, because even if it's been done pretty soon, I mean, in my experience, it's only been in like the first couple of weeks, maybe, that a lip and tongue tie done. There's been some cases where babies are younger than that, but regardless, like from birth until the moment of that revision, the baby's been trying to feed mechanically with that revision, or with that restriction there. So on the other side of it, there's a relearning process that has to be done, where neurologically the baby has to coordinate opening, the lips flanging, the tongue pressing, all of those things. The suck, swallow, breathe is new to their system. So chiropractically, we can clear out the brain body interference that might be getting in the way of baby relearning that, as well as calming their system after having a surgery like that. So ideally, I want to see them before and afterwards. A lot of times I see kiddos afterwards, and because the pediatric dentist that's done that procedure knows, all right, neurologically, almost in a physical therapy sense, beyond just needing to do the exercises and the swipes to make sure that that revision doesn't, or the restriction doesn't re-heal in that way. We want to make sure they're learning in that process, and neurologically, that's how chiropractic can help.
Well, and after you do revision, you're doing stretching and all these exercises. It's important to have the chiropractic to aid in that, so that that revision that you didn't want to do, that was uncomfortable for you to have done to your baby, sticks, and you
Right.
get the full benefit of it, because
Exactly.
it's a waste if you have to go back and redo it in 2 months. Like,
Totally.
just a waste.
Right.
And
And it's a
it's,
stress because, oh my gosh, I did this once and now I got to do it again.
yeah,
And you just want to do it right from the get-go.
absolutely. And before we get into why we should have regular adjustments in pregnancy, because of our growing body and the weight and all the things, tell me about the Webster Technique and why that, where it came from, why it's important, why that they should be, a chiropractor should be certified in that if we're going to be going there
Sure.
for our pregnancy adjustments.
Yeah, so a lot of people have now heard of the Webster Technique as a pregnancy technique that hopefully your chiropractor is trained in. And the Webster Technique was designed by Dr. Larry Webster. He was the original founder of the ICPA, who's since passed now, but his work lives on, and all of us chiropractors that are working with pregnant moms. And it's essentially, it's an analysis system of detecting, is the pelvis misaligned? Is there tension in the uterine ligaments? And then a method of releasing that tension, so the woman's body is in balance. The uterus is in proper tone. We work with the round ligaments on the front and the pubic bone in the front of the pelvis, so that everything's optimized space wise for baby to move into proper position, as well as the body's optimized for birthing. I mean, the woman's body is designed to birth. The uterus is in her body to grow babies and birth babies. So if the nervous system's functioning normally, then that birth is going to go much more smoother than if there's torquing in the pelvis. And that's what the Webster Technique is designed to do. And not every chiropractor is trained in that. So that's another reason why, looking on the ICPA website, you'll see which chiropractors are trained and certified in it, that are maintaining that certification, so that you're going to someone that regularly works with pregnant women and is trained properly in that technique, rather than a chiropractor just adapting their normal technique and trying it out with a pregnant spine. The pregnant spine is very different, as I said, with the babies being different. The pregnant spine is very different than a regular spine. So you want to have somebody working with that, so you're being taken care of safely as well as effectively, so that birth is optimized and it's going to be easier, not just for you, which we absolutely want, and our research shows that, but it's safer and gentler for baby coming through as well.
Well, and my telltale sign is, science has proved that you have shorter, faster labors with less pain if
Right.
you've had regular adjustments. So
Yeah.
why wouldn't you,
Totally.
other than cost being a barrier, to me, it's for the credit card if I have less labor. So
Right.
for me, that's just me. But yeah, I see that a lot, because everything's in alignment. There's a bigger space. Things are more open and relaxed. And tell me about the tight pelvic floor, because I have so many moms that are diehard exercisers before, and they do spin class and they do all the things, and everything is tight. And when we're in labor and we want this baby to come out, we want loose and floppy and open,
Right.
And we want release, not pull up. Like even in yoga, we're pulling up and tucking that tailbone, and we want everything to release. And if we already start with a tight pelvic floor, that chiropractic is going to make a huge difference in loosening that, so that we can release the baby.
Right. And it all comes again down to alignment issues. Like, if the body's misaligned, the nerves are irritated. And if the nerve that goes to a muscle is irritated, typically it gets tighter. So if you've had that experience of your back spasming or your neck being spasmed and tight, like, it's because the nerve that's going to that muscle is overly tight. And you can try and massage it and you can try and stretch it, but it won't release out on its own because it's under unconscious control. And that's why adjustments helps relieve that tension. The body can balance and the muscles soften. So going down into the pelvic floor, yes, like the women that I work with that are exercising heavy in pregnancy, I'm talking with them really strongly in the second
Yay.
trimester to throttle down on any kind of ballistic exercise that's jumping up and down, running, those CrossFitters that are doing like weighted squats, doing box jumps, doing wall ball, like all those kind of things are great outside of pregnancy to tone and strengthen the pelvic floor. But in pregnancy, just as you're saying, if it's overly tight, you can be working out a ton and being fit for birth, but if the pelvic floor is so tight and it doesn't open up, then even if the pelvis is aligned and you're fit and you're strong to birth this baby, the pelvic floor can get in the way. And some of those CrossFitters I've worked with that continued on doing their workouts right up until birth, they went C-section because the pelvic floor is too tight and it
I've
wouldn't
seen that.
open up. And so I have learned over the years, at first learning that, I used to teach, don't Kegel, don't do any kind of pelvic floor exercise at all. And what I've learned now is one of the women that was on the podcast was exercise physiologist for pregnancy. She was wanting women doing Kegels, but doing it in the same way that if you're doing a workout and you do a bicep curl, you do negatives. Negatives are when you like flex up, but then you slowly let it down rather than just like flopping it down and then doing like 1, 2, 3. Like with a Kegel, the same thing. She was instructing, I want women Kegeling up to tone the muscle, but then also being very conscious and feeling the letting go. So that one, you're getting the toning, but you're also getting the release. And what she said too was, if a woman's been Kegeling, and the women in pregnancy are told to Kegel, doing those pelvic floor toning exercises, because to prevent on the other side incontinence issues, prolapse issues, those kind of things. But if you're overly tight doing the Kegels, it could cause those problems because of the tightness and the damage that's caused in the birth process. You kind of undid what you were trying to do. So what she says with that negative of knowing what it feels like to let the pelvic floor down or go helps, because when baby drops down into the pelvis and you feel that pressure there, if you've only ever Kegeled up,
Yeah.
unconsciously or consciously, you'll tighten up because, oh, that's my pelvic floor. Boom, stop the stream of pee. And you'll tighten up against it instead of understanding, okay, that's my pelvic floor. Now let it go. And that's what you teach in your classes of like, how do we let that pelvic floor go? How do we let this baby come on in rather than trying to force it through something that's tight? So that's super important to make sure that, yes, we want you strong and we want you fit in pregnancy, but it looks totally different in the third trimester. Your goal sets as far as fitness are totally different. We want you having strength and flexibility in your pelvis and your arms and your legs to be able to have all birthing positions and all birthing comfort measures available to you during labor. So you want to be strong if you need to hold a squat. We want you strong to do that, but we don't want you overly tight. That is going to take some of those tools out of your toolbox if you need them during labor.
Absolutely, 100%. We talk in class about loose and floppy vaginas like a stingray. So it's
I remember.
wide and open and
I remember.
Yeah. The stingray is just open and loose, and that's what I want your vagina to be.
Right.
I don't want it to be like this tight and tiny hole. Loose, floppy, and open. And we get really funny stories back about vaginas floppy.
Sure.
And side note,
one thing before we go on about pelvic floor, we talked about like exercise and tightening it, but as far as like misalignment can do the same thing, in that if that nerve in the lumbar spine and the sacral plexuses in the pelvis that's controlling function of the pelvic floor, you might not be doing box squats, you might not be running, you might be doing everything right, but if that misalignment pattern is there, the pelvic floor might be overly, it's not spasmed, but it's overly tight. So that's another side benefit of having the birth canal be in proper position for baby to come through. And that's, again, like what we're working with Webster Technique, is not specifically like, is the nerve to the pelvic floor balanced out, but among the whole region of all those areas being in position. So the pelvic bowl can be in proper position to receive baby's head, that the birth canal, if you look, if you're listening, you won't be able to see my hands, but I'm holding it in a big round circle. You want it as big and as round and as symmetrical as possible for baby's head to come through. But if the pelvis is misaligned and it's torqued, my hands are going to a more football shaped. And if it's football shaped, that's harder to push a baby through, if not impossible. So that's the reason why Webster Technique is constantly looking throughout the pregnancy to make sure it's in balance, so that you have a big hula hoop to go through, not just a basketball hoop, but a hula hoop for a baby to come through much more gently and safely.
Yeah, the bigger the better, always.
Absolutely.
And a tiny head. We always want a tiny head. And side note, I'm really impressed that you know what box squats are, because I have no clue, because I don't exercise. So I'm sure that that's a real thing for some of you, but I will never know what that is, and I'm totally okay with that. So when do we in pregnancy start with chiropractic care, and how often do we need to come? And I get that question all the time.
Sure. So again, is the sooner the better to get checked to see, are there tension patterns, misalignment that you brought into the pregnancy that then can be corrected much simpler, much quicker, with less frequency than if we're waiting to the third trimester. Because imagine if the pelvis is tilted because of a snowboarding accident or chronic running they had before, or a car accident you had before you got pregnant. That misalignment in a snowball effect as baby gets bigger and bigger in the pelvis, as there's more and more amniotic fluid, as the body is making all these amazing changes to do it.
Bigger boobs, heavier boobs.
Exactly. All the postural changes that happen, then that misalignment pattern, like say if you're it's the same thing as like saying like the alignment in your car is off. Like it's going to continually getting worse and worse and start balding on one side of the tire because it's finally being stressed for a longer period of time. So if I can see a woman like as early on as possible, like in the second trimester, even like the end of the first trimester, these gentle techniques that we're working with is safe to work within in the first trimester. But if a woman's feeling safer to do so after that first trimester has been passed through, then the beginning of the second trimester is ideal to do an assessment, see where the misalignment is, what kind of work we may need to do intensively to get the body back into balance. And that kind of depends on how much stress and how much misalignment and what you brought into the pregnancy. Does that take 4 or 5 visits? Does it take 8 visits? Does it take 2 visits? It kind of depends on what we find in the exam. But then typically once things are balanced in the second trimester, I'm seeing women every other week, every 3 weeks, maybe monthly if they're really healthy coming into it. And then usually around the 28-week, 30-week mark, like into the start of the third try, I'm seeing women on a weekly basis, ideally, because one, we want to make sure things are in alignment. But if a week goes by and things are starting to tip because baby's gotten exponentially bigger in the third try, exponentially bigger means a lot bigger each and every week. Like every week, moms are saying like, oh, there's no way it can get any bigger. I'm ready to go. And they're only at 34 weeks. And I'm like, okay.
We're talking 10 more inches. Sorry about that girth. It's coming.
So the more the body is in balance, one, for absolutely, I want moms to be comfortable. I want them sleeping better. I want their hips feeling good. I want them walking as much as possible. That pain and discomfort isn't keeping them from doing that or having them being more and more depleted because they're not sleeping well. I mean, third trimester is tough sleeping period, but if you add the pain and misalignment onto it, we can take that out of the way to be able to be much more rested. And that's going to serve baby well because they're growing in an environment that is more stress-free, more healthy, more rested. And that also is going to bode well for recovery and postpartum, because if they're healthier in the pregnancy and have a smoother birth, there's going to be less on the other side to need to correct in a postpartum sense so that their body's healthy to go into mamahood, so that they're focused on baby and all of that great development of mama baby relationship and learning all their cues, rather than also having to deal with birth trauma to their mama's baby that could have been prevented by having their bodies healthy going into it.
Well, and if the birthing person is getting really good quality sleep that last month, their labors are shorter. They have a less chance of a cesarean. Like sleep is so important.
Yeah.
And I still chastise my moms when they're like, I just totally watched all of Schitt's Creek for 6 hours and I couldn't sleep. I'm like, get sleep. You got to figure it out. Totally. But alignment really does help with that, because if you're not so sore and you're padded up with pillows anyways, just to be balanced, and you've got dogs all over you and it's so uncomfortable. I've seen
every few hours, right?
Every 2 seconds.
We want to be able to have, you comfortable like in between those times that it like, yes, like you finally got the pillows set and then oh my gosh, you got to pee again. You got to start all over again. Like that frustration factor is there, but we'll want you, once you get back into bed, settled and sleeping, even though it might be intermittent sleep, the more restful sleep you're getting, the time like adds to your bank account of sleep, of rest, that allows you to be stronger going into birth. It allows you to birth in a much more powerful way and then be that much more ready for mamahood on the other side.
Well, and what I see is if families have already been going to chiropractic, afterwards it's a no-brainer. They're going to go. You've got a baby, a carrier, a diaper bag, breastfeeding issues from forward leaning all the time and holding a baby in the wrong position, and you're exhausted.
Yeah.
And that sleep that you do get after is so critical and so crucial, and you only get like that much of it. I don't want to scare you, but you don't sleep for a long time.
Yeah.
And the chiropractic, when should we be going back for those adjustments? And if we haven't ever gone, we need to start going.
Right. And that's something that, you know, thankfully, as you said, like moms that have been taking care of themselves well throughout the pregnancy with care, like want to continue that healing process on the other side. It might be that misalignments and trauma and damage has been created because of the birth. And we absolutely want to correct that as soon as possible. But again, like mamahood and new parenthood, like it's a stressful state. Like you're learning your new baby. If it's your first, you're wondering like, all right, like, am I doing okay? Like you're not sleeping because baby's like waking up and it's an intermittent time. So your body's not in a rested, healthy state. We want you as taken care of and sustaining as much as possible throughout that time. So a lot of times what I see is that moms, and this is a blessing of theirs and a curse, is that like, okay, whatever it takes for baby, like to help them sleep. And sometimes a colicky baby, a baby that's fussy, not sleeping more than 20 minutes at a time, getting adjusted and clearing out, like that allows them to get more sleep. And that is a true benefit. But then what about them as far as like making sure pelvis is aligned and comfortable, and that, again, as you said, like all of that stress then goes in the neck and shoulders because you're head down looking at breastfeeding, you're changing the diaper bags, all this stuff, all the cuteness is in front of you. And so there's a lot of headaches, a lot of neck and shoulder problems that will happen because you're holding this like 8-pound bundle of cuteness all day long and you're looking down on it because they're so cute, and that takes its toll on the neck and shoulders. So like it isn't a luxury to have those kind of that care for mom on the other side. It's absolutely essential so she can be as healthy as possible to take care of her new family and recover from 9 months of pregnancy, to recover from a birth. Like that absolutely just by itself would warrant a lot of like recuperative time and healing time. But then also you're doing it in a stress state and taking care of a baby. I'm not trying to say that like newborn care is horrible or anything, but it's hard. It's really hard. And so you want to do as much as possible to be as strong and healthy to be able to do it as effectively as you want to do it.
Well, and one of the things that we preach, teach, and highly suggest during classes is the preparation for postpartum, because postpartum is for the rest of your life. Your birth is literally over like this, even though you think it's going to take forever. And the pregnancy you thought took forever is this much time, because postpartum is the next 50 years. That's just how it works. And we want our families to have a lactation consultant before they have their baby, so they have a friendly face, they know who to go to, a therapist, so if anything comes up, they could even do telehealth. And that person already knows their history, and a chiropractor, and an acupuncturist too. But those four are critical for just self-care in general. But if there's an issue, you already know them, they already know you, and you're not starting from scratch when you're so tired and depleted and sore, possibly from a surgery, or whether there's trauma there. You have 4 friends in the wings that are professionals to really help that recovery process. It's crucial.
And that team around you, just as you said, like if they know you going into that experience, they're going to be able to detect things that seemingly are normal to you because you're used to them, that they as a trained professional would recognize like, oh, we can give you some support here and some help, because it seems like this area is struggling right now. And you're like, well, what do you think? Like, especially if you're a new mom or a new dad, like you don't know any different. You just think like, oh, I guess babies cry. They were right. I'm like, no, okay, this is a little bit more than kind of normal baby crying. Or the fatigue that you're feeling and the moods that you're feeling, it's a little bit more. Let's get you some support in that way. Or your body's not healing as fast as would be expected, so let's get you some extra support. And so you have that knowledgeable team that you already feel comfortable with, that has seen you through a period of time to be able to recognize those changes more so than you in a sleep deprived state could be able to do. So I think absolutely like a lactation consultant like is so important to make sure that you start off strong, you start off successful, rather than waiting for a problem to happen and then getting a consultation. Because, and this is something that your breastfeeding classes like address so well, is sometimes you don't even know what's a problem until it's been going on for so long that then finally you divulge something like that to a friend or maybe a doctor and said, oh my gosh, you've been doing that for 8 weeks. Like, oh, okay, like let's do this. And so you don't know what you don't know until you get educated on it or have a trained professional to assess and to know how to do it right there. So that I think is so important to have a lactation consultant on your team before you start it. So that can be a part of the regular thing in the first couple of weeks of making sure like, let's get this dialed in, course corrected if we need to right away, rather than waiting for the wheels to fall off months down the line and make it that much more challenging for breastfeeding to be successful.
Well, and those people will know your baseline.
Yeah.
So they've known you before, and afterwards you're like, oh, not normal, where you're just so tired you can't even see straight.
Right.
And literally, I remember thinking, how can I survive the tired I feel?
Right.
Because I was getting pretty good sleep too. I had 24-hour care with all of my family and stuff, but I literally didn't understand sleep depravity until that. And I was like, I can see how they could use this in torture situations in war. It would work on me. I'd give them every secret.
Totally. And that's why like having a therapist that you've worked with would be able to differentiate between the baby blues and what might be looking like postpartum depression. Because I remember that fatigue, it's the fatigue of just not sleeping and you're in a stress state because you're wondering like, is baby going to sleep through the night and all those kind of things, and trying to be the best parent you can, but not knowing what the hell you're doing. But then with that fatigue as it gets on, like what I see around kind of the 6 to 8 week mark with new parents is a hopelessness, like a feeling of like, there's no light at the end of the tunnel. Like I'm never going to feel rested ever again. And I don't know if I can deal with that. Right. And
I don't even like this baby anymore. Yeah,
totally. And I say that, I mean, I try to make a joke of it, but it's absolutely true of every parent in that window of time was like, oh my God, what did we do? Like we could be in Paris right now rather than like trying to get this baby to stay alive. And that's just true. I mean, we love our kids. We get that second win. We're back in, like we'll get to Paris another time, but there's that feeling of, oh my God, what we do? Like there's a mistake. Like I love my baby, but like there's a mistake. And it's that team around you, whether it's trained professionals or it's your friends and your family, that can carry you through that have been through that experience, to say, totally normal. You totally get it. Like you don't love your kid any less, like wanting to be out of this situation right now. You're just going through the trenches and we're here to have support through it. And your education process and like talking about these things beforehand, maybe it doesn't set up every single parent as I wish, and I know you wish, to have that team assembled, but at least they might go seeking it sooner because they've heard you or they've heard me say like, oh yeah, probably around like 6 weeks, you're going to feel this, this, and this. And it's in the back of their mind. So then when we think that, they don't think, oh my God, I'm a horrible person. Like I hate my baby. And well, like, what am I going to do? Right. And then they shut down even more. It's something where they've heard about it. They know that that's, if they feel that or think that, it's somewhat normal. And these are the people to talk to get support throughout it.
Absolutely. I like how you go, we could be in Paris right now. And I'm like, I just want to shower by myself. You go straight to another country. I'm like, no, just pee, poop by myself. That's all.
Right. No, I always say Kauai. I'd rather be in Kauai rather than Paris.
Me too. Yeah, right. Agreed. Let me go snorkel. That will get me away from my child. And don't feel shame about that. That's so normal. And it's also normal to be like, I don't even like my partner. I don't like them. I can't stand. I don't even like myself. Normal. It's all normal because you're
Totally.
tired and you hit that breaking point, and then you will get that second wind.
Right. Yeah. And the more you have a team around you to assess that, the better.
And the sooner, the better.
The sooner,
Yeah.
the better. True.
Absolutely. And I really want people to take this podcast today and this free video that we're going to have on our website, talk to your friends about it, and get chiropractic care more mainstream. Talk about it in your mom's group, talk about it with your moms, your dads, like everybody around you. Like, this really helped me because that telephone effect will help it get more mainstream, because we're not talking about it at the hospitals. We're not talking about it. If you've had some trauma at the hospital, they're not saying you should go see a chiropractor as soon as you can, because they don't know about it.
Right.
It's alternative health, but it's actually not alternative health. It's crucial health. And because you don't even see your OB for 6 weeks, and we have such crap maternity care in the system that way, we have to find it ourselves. And the way we help others not suffer through, especially in their first baby and their second and their third, is to talk about it.
Right.
So I want you to open your mouth and really help at this mainstream, because it's good care.
Right.
And it's essential to balance out stuff that we have control over.
Right. And that's why like creating community is so important. I mean, I think women have done it much better. Like, moms will feel like they're isolated and the like, but once they can get out of it, there is a lot of community for moms to be a part of, to get that feedback of, oh, this is normal, you got through it, I can get through it. Or, oh, this isn't normal, let me get some help. Dads too, like, we need to talk about it. I'm trying to do a lot for creating community around dads that will shut down because they're so overwhelmed, and they don't want to look like they don't know what they're doing, and they want to be the good provider, they want to be the good protector, they just don't know what they're doing. But having that time afterwards to talk about the reals of what's going on, to be raw about what's going on. I find, at least in my circles, that the dad's group I lead, and even with the parents, like, if invited into a raw conversation about what it's really like, people will jump into it and say, no, this is what it was like. I didn't like my husband for like weeks afterwards, or I just wanted to escape, all those kind of things. But there's the kind of version that I'm not that way, but a lot of parents like won't talk about the like hard part, especially those first 3 months, not wanting to scare them, not wanting to like freak them out or anything. But I think it can serve them better if they're just really real about it, and not saying that, oh my gosh, you're going to like, it's going to be a train wreck of a time. Just being really real, like, it's going to be really hard, and I can be here to help you. And that might be practitioners, but hopefully it's like a community of women, a community of new moms. That's what you create with your boobs group. That's what I'm trying to create with the dad's group, to have peers that have been through it before help and lead and guide through that experience, so they don't feel so alone.
Well, and don't even get me started on social media and the non-authentic projections that we have on there, because we do feel shame if we're just looking at all those beautiful pictures and, oh, they're having a great time. Why am I so upset? Why am I so depressed? Why am I so inadequate? They took 20 of those pictures, and you know that, and the light was right and whatever. And then they went right back to crying and being upset. Yeah. That's just reality. There's no one that escapes that. Right. So really finding your group of people and your community. Now with online everything, you can find somebody, even if it's in a different state. Right. Somebody's going through the same thing you are.
Yeah. And that's why I appreciate your Instagram account so much, that you have like beautiful birth videos and kind of the realities of what things are, not in a trauma sense, but just like, so you can actually see it. But then all the pictures you do are like kind of like real momhood afterwards, and like real bodies and everything, not this like sculpted 6-week body that like, how did that happen? Like, just so that women can feel more normal within it, rather than like the Pinterest version of parenthood, which we keep comparing ourselves to and thinking we're doing a horrible job because we don't look like that mom, we don't look like that family, when reality is, as you said, like they just posed everything perfect for the time, and the reality is like everybody's having a hard time. So if we can all feel more normal and not so alone in it, then we're going to have a much better experience, a more healthy experience, and a more real experience.
We need balance with no filters. Yeah. And that's what we don't know how to do anymore. No. So I always want to say, remember that, well, you guys don't know because you're probably way younger than me, but we just took a disc camera and we went up to the mountains and we played all day and we didn't have a cell phone. And we were lucky if we had an answering machine at home that would catch a message if it came in. And if somebody died, we didn't know because we were playing in the mountains.
Right.
And that's just what life used to be. And it's not like that anymore. We are on our phones the whole time. We're disconnected. And I think that has done us a huge disservice, even though there are some benefits to it.
Right. Yeah. And it takes a really conscious effort because we're so used to that. Like, if you like leave the house to go to the store and you forget your phone, like I'll turn around and go get my phone. Like, really? Like, I'm driving back to the driveway. Like, what am I doing? Like, I can go for a walk without having my phone. Like, I should be okay, but I'm programmed into it too. So it takes, especially when you have your kiddos, and this is a different conversation, like to put the phone down and not to take a picture of every single thing, which we want to, because they're super cute and they're changing so much. And we want to document and send it to the grandparents and all that kind of stuff. But it is a source of distraction, and it's a source of disconnection that if we put that phone down like that, it's going to allow you to be more present as a parent. That's a whole other conversation, but I think that's really important and something a lot of parents struggle with.
Absolutely. And to wrap up, where do we go to find a chiropractor in our area? I know we mentioned it at the front of the podcast, but where are we going, and how do we find a specialist?
Sure. So it's through the ICPA website. It's ICPA 4Kids, the number 4kids.org has on the top of it, find a chiropractor. And so you go onto that page. We can include the link in the show notes here, and you enter in either your city or your zip code and a radius, and you can do like a tight radius. If you live in a place where there's a lot of chiropractors there, you can do a 5-mile radius. If you're living in an area that just doesn't have as much of those services available, you can do a wider radius. And again, you had mentioned this before, but I want to reiterate is when you go onto that site and you find these chiropractors, click on their websites. And if their landing page is all like baby bellies and pregnant bellies and babies and families and stuff, that that's their real specialty. Like my website's like that. As soon as it pops up, you're like, okay, like the guy does something with pregnancy and babies, obviously. Versus there are some people, and I'm not judging that, but they might have taken the Webster technique and they might be certified in it, but they really kind of have a sports chiropractic practice and a PI work comp practice, and they've taken this in order to be on the list. So you want to like really go into that specialty there. I get through this podcast and a lot of like social media stuff I do, I get a lot of requests where like, hey, I'm in this area. Can you find a chiropractor in that way? And I'm happy to help with that. I usually refer them back to that website if they don't already have it, but we'll make sure that link is there so you can find somebody that can take really good care of you and your family.
Fantastic. Thank you, Jay. This has been really fun. I love to talk to you.
Yes, this is great. I could talk to you forever about these things.
Well, we have lists of stuff we could talk about. That is for sure, because it's all we talk about is vaginas and babies and backs. I don't know.
You're talking about vaginas more than me, to be perfectly honest, but I participate in the conversation.
Very true. Yeah. Very true. That's what I talk about mostly. Right? That's why I don't date much, because they have to be able to withstand that. So there's that. All right. If there are any questions, you can email either one of us and find information on both of our websites. And thanks for letting me hijack your podcast today, Jay.
It's been my pleasure. We'll make sure we got all these resources in there, going over to the Birth Education Center and all the amazing work that you do there. And let's just get more information out to these parents so they can have a great, fun time and create a solid foundation for their families.
Thank you. Thank you. Thank you.
Thank you, Care.
Bye.
Bye-bye. And don't forget, I have 2 free offers for both moms and dads. First, for the moms, I have my 40 ways of connecting with your baby during pregnancy that you can get on my website at drjwarren.com/40ways. That's 40 ways. And for the dads, I have the 9 myths about becoming a dad that is also available on my site at drjwarren.com/9 myths. That's the number 9 myths. So both moms and dads are covered. Go check them out. I hope you enjoy them.